Hello, my name's Mandy. I've got a few moments before I take me mum to Monday bingo, so I've something to say on National Health Service, since no election candidates have been to see me, so I have to have me say. This is part of Mandy's Manifesto. The NHS in its current state cannot go on working. It's like driving a car for 40,000 miles without having it serviced or an oil change, or sliding down an hill on a sledge with no means of stopping. Our health service in this country is best in world, but it'll need help getting better. The telly and papers only tell bad stories, and that's okay. There are real cases where real people have been hurt, and them that done it should be named, shamed and punished. But there are also good cases that we don't get to hear about because they don't sell no papers. Up here, I mean north of England like, we have the best care. I speak from personal experience. My mum were in hospital a couple of weeks back, and the care she had for that one night were fantastic. The doctors, nurses and others were brilliant. She even said the meals were fab. Were they as good as mine? I said. Yes, she said. However, the NHS needs a massive injection of money if it's going to cope with the future and a growing and ageing population. As I said the other day, cut waste, not funding. Why are some people given a death sentence for want of a new drug, but someone who is probably sitting on their flipping tail end for doing nout say there's no money for it? But there's money to pay for so-called management consultants. I say, let the NHS be run by doctors, nurses and other healthcare professionals, and get rid of them number crunchers and management consultants. And another thing, if you're visiting this country and you get sick, then you must pay for treatment. That's what insurance is for. If I needed help in your country, I'd either have to pay for it or claim on my insurance. Don't expect everything to be handed to you on a plate. We must take responsibility for our health, although I know there are some things, some cruel things that are out of our control. That's when the NHS comes into its own. I would never dream of going to doctors with a cold or a sore throat. There are some ailments I can either treat myself or go and see a chemist. So whilst I'm on the subject of responsibility, give up smoking. You'll feel so much better and you won't smell like some mouldy old chimney. And whoever thought that being mega fat were a disability? I'm this size because I eat too much of the wrong food and I don't exercise enough, but I'm doing something about it. I am responsible for what goes in here. So, fellow fatties, unless you have an underlying medical condition, get off your tail end and get walking. And another thing, if you get drunk and end up in hospital, then it's your flipping fault, and you should be given a bill for being such a bellend. We need to get back to basics. Medical people are working flat out with what they've got, but they need financial support if we're going to remain best in world. Now, if you'll excuse me, I need to go, but thank you for listening.